Okay, you guys, it's Christina. Where have I been? I know that some of you guys have gotten a little bit worried because I've been vlogging for 2 years and I have never missed a week. And then I just missed like an entire month. So I'm very sorry if I worried you. I was just kind of blindsided and I was just physically not able to edit or upload a vlog. So I apologize for that, but I'm back now to explain what happened. Also, there's kind of just like no flattering hairstyle whatsoever that works with this brace, and the whole back of it is Velcro, so your hair gets really caught in it. Okay, we good? This head strap is just like adding insult to injury, literally. And I did try to vlog, by the way, so there is footage. It's just kind of broken up between my camera, my phone, my mom's phone, whoever's phone was with us. And I kind of felt like I couldn't just sit down and upload another weekly vlog after disappearing for an entire month without explaining a little bit about what happened. So this video might end up a little bit more like a story time video than a vlog video. I'm not really sure. And I'm going to apologize in advance because this video is probably going to be pretty long. And there's probably going to be a lot of jump cuts because I haven't quite gotten the hang of breathing and talking at the same time. Oh, and that noise is just my saline pump and feeding pump. I know it's really annoying, but that's life. But I feel like when I left you guys, it was probably a day or two before I was scheduled to have a spinal fusion surgery. Good morning, you guys. Happy Tuesday. Today is the day. Today is surgery day. I'm wearing my very appropriate shirt for the occasion. So cute. I'll link them down below. My friend Jen designs them and she's really awesome, so you can give her some love. I've kind of leveled up from the neck brace shirt to the back brace shirt, which it's kind of ironic that I have it off right now, but I'm just trying to give my body one final rest of that brace before I'm going to be in it for quite a while. Unfortunately, it sits right on my shunt and right on my feeding tube, so it's not all that comfortable. Anyway, I told you guys a couple months ago that I ordered a bunch of temporary tattoos with my important conditions and allergies on them, and that I was going to try wearing them next time I went to the hospital. I guess that day is today. I'm gonna try putting it like right on my forearm. That way they'll see it every single time that they check my medical bracelet, which is something that they do constantly in the hospital, so you kind of can't miss it. We'll just have to see what my doctors and nurses say about it. I'll let you guys know how that goes over. And the car won't start. Is this a bad omen? Definitely not very comforting morning of surgery. Attempt number 2. Jean's gonna drive us. Thank goodness the hospital is right down the street. The universe is against my zen today. I am in pre-op. I was doing pretty well until we took off my brace so that they could access my port. I started to have the spasms down my neck and back again, and then through my face, I couldn't keep my eye open, and I just started to get this headache. I was just rocking back and forth holding my head, and it seems to be that it was just those muscle spasms moving up and behind into my jaw and into my eyes. They gave me some IV Ativan to see if that would relax the muscles, and that seems to be working. It seems like we're all good to go, and I will check in with you guys after surgery. Hello, you guys. I'm going to keep it short this week because I don't have much of a voice. I had a bit of a difficult intubation, and also it's hard to hold up my camera right now, but I am doing pretty well. I'm not really pushing the pain button much. My doctor said the surgery could not have gone better, but when he got in there, there was a lot more instability than he expected. Everything was very loose, which really lines up to how I've been feeling. I kind of figured it would be worse than the imaging. I've got a drain in my back, which is kind of gross and driving me pretty nuts. Yeah, so that's basically where I am now. The stupid drain sticks out of my back, like directly where the brace comes across my back, which is not ideal, but we're working through it. We have me kind of turned on my side, but it's really difficult for me to turn right now. I think that
once I get up, I'll be okay. I haven't been up yet, so I still have fully catheter. But once I get up, I think I'll be all right. It's just moving that's really painful. You know, they cut through all the muscles in the back, and then I still have my healing wound in the front with the shunt, so I don't really have the abdominal muscles to take over for my back muscles. I'll get there, but I think I'm just gonna try to get some rest right now because I don't want to be taking too many pain meds, and I find the best way around that is just to try to go to sleep. I'll talk to you guys a little later, okay?
We're on line. Christina is kind of flat. Let's see, let's get you.
Don't go too close.
Here's Taylor and Nicole. Nicole's all the way from Australia. And Taylor comes from Australia but lives in New Jersey. And they came to visit us.
The third time that we've kind of just run into Taylor.
I know.
I know.
It's so been like
They surprised us.
After surgeries.
So this is one day after Christina's surgery. Okay, we have the happy pill, which really does make you laugh. You just can't help it. We have these beautiful balloons.
I stepped on it in the middle of the night.
Oh my gosh.
I was gonna have a heart attack.
That's funny.
Hi guys, it is day 2 after surgery, and I am doing pretty good. I am in a lot of pain, but I asked to be taken off of the morphine pain pump this morning. This made the most sense to get off the pump. We obviously want to get out of here, so any step that we can make towards being more independent is a good step. And then today I was able to sit up, I was able to get the catheter out, and I was able to take a good walk around the floor. For some reason I just cannot like really scooch around or turn in bed, and I think a lot of it has to do with the fact that I just had a lot of the stomach muscles cut through for the shunt. But so that was really hard and kind of discouraging. I thought that was really going to affect my ability to walk, and it didn't. I think once I get up, I'm good. It's just moving that hurts, I guess. And you can probably tell my voice is still kind of weird. I'm not quite sure if that's how long that's gonna be around. I hope it goes away, but if not, here's my voice now. I think it's just they had a hard time with the intubation yesterday, or 2 days ago. Even though, have I talked to you guys about this since? You guys know I had like failed intubation here last year, where they tried to just put the breathing tube in once I fell asleep.
It was actually in February, so still this year.
So, okay, so it wasn't that long ago. But it didn't work, and it ended up causing a lot of issues. So since then, we've come up with the awake fiber optic nasal intubation, and that has worked really well. It's not fun. You kind of have to be awake. So they put like a guide in your nose and like these dilators and stuff like that, and then they thread the breathing tubes up through your nose and down your throat and into your lungs, and then they put you to sleep. So it's not fun by any means, but it works. That's really all I needed it to do. So if you were wondering what we've been doing ever since that intubation issue, that is what we've been doing.
So I had the surgery. It ended up being a little bit more extensive than maybe what we had planned. We opened my back up from T4, which is about here, to L2, which is in your lower back. It's your second lumbar vertebra. And he kind of just refused and restabilized, took old hardware out, put new hardware in, put some bone in there, took some of my bone marrow from my hip, put that in there, and just really refused and solidified that area. That was actually a very, very major surgery. It was the biggest fusion that I have ever had. It was probably one of the more painful surgeries that I've ever had, but I was actually able to get up and moving pretty fast. So I got out of the hospital much earlier than we expected. I think I only spent 2 days in the hospital, and I was up and walking and wanted out.
I am about to be discharged. Unfortunately, I'm going to be going home or home away from home with my drain still in, which I was really excited to be getting the drain out today, and unfortunately I'm still draining too much. I have to say the pain is horrendous, and I don't say that lightly. I always warn people thoracic fusion is a big deal. I've had every part of my spine worked on. I've had my skull, I've had my brain, I've had my neck, my lower back, my tailbone. By far, the thoracic, your mid-spine, is the most painful place to have surgery because everything is attached there. So if you think about it, like all of your ribs, they go around and attach to the side of the vertebra. And so when you mess around with the vertebra, you're messing around with the ribs. And ribs are important for things like breathing and moving.
So I actually went home with the drain still in. They put a drain so that any extra fluid and blood that collects can drain out instead of causing swelling and getting trapped. So I actually had the drain in for probably 3 days after we left, which was one of the more miserable parts of the surgery. I really, really hated that drain. I have a lot of nerve pain issues in that area anyway. The drain and I weren't friends, and I was very glad when it was removed. But anyway, like I said, we went home to our friend's house, and I did a lot of sleeping and relaxing. Each day I was feeling a little bit better until all of a sudden I was not. And I got very, very sick very, very quickly. All of a sudden I just started to feel like really achy, chills, feverish. I went really, really limp, and I was really exhausted, and I was just kind of getting out of it and starting to hallucinate. My mom was not impressed. She was like, your color is terrible, you're running a fever, we have to go to the ER. And at this point I knew I had to go to the emergency room. I knew that I probably had sepsis. I felt like I had like acid or broken glass in my veins. I knew that I was really sick. But the last thing you want to do when you're feeling really sick and you can't move is to go anywhere, and especially the ER. But my mom made the call. She texted my surgeon. He told us to come. She called an ambulance because I couldn't move. She had a broken wrist. I was upstairs, and there was no way that we were getting me to the car. So the ambulance people came, and I was like barely dressed. They put me on this chair thing. It was like this hard plastic chair that they use to get you down the stairs, which was really, really uncomfortable on all of the hardware in my back. So I was actually crying. The EMTs felt really, really bad, but there just was no other way to get me down the stairs. So we got down the stairs, we got to the hospital. Like, props to you guys who like are able to vlog or like Instagram from like the back of the ambulance or the hospital when you have sepsis, because it took me like 2 days before I was even able to like lift my phone. I was just that sick. So we took the like 2-second ambulance ride to the hospital, and then we had to wait in the kind of like ambulance bay where all of the people who are coming in with EMTs have to wait before they're in the hospital system. So I felt really bad because the EMTs had to wait with us for like 2 hours before we were able to get into the hospital system. And I was just like hallucinating. I had like I was shaking and seizing, and my mom was trying to hold me down, but she's got one arm, and I was really uncomfortable because I'm still on that plastic thing. I hadn't had any of my normal home meds. I hadn't had any pain meds. I was starting to go in adrenal crisis, and we weren't allowed to administer any medications, but neither were they. So it was just kind of a mess. And then we got into an ER room, and our nurse was awful. Like, she was so bad that I have to laugh at how comically terrible she was at her job. At one point, my doctor had to take her aside and just like lay into her. But anyway, I was in really bad shape. My stats were in very bad shape. They were so bad that they weren't able to give me any pain medication because my blood pressure was too low. So that was really fun. And of course, because I clearly had some sort of infection going on, we needed to run a lot of cultures. And because we suspected that the port was the culprit, we had to take a lot of cultures from my veins, which are not very friendly. I still have bruises from that process, and may always have bruises from that process. But after many hours in the ER of taking cultures and me shaking and crying, they finally were able to get an IV line into me and started running a few different IV antibiotics and some fluids. And we eventually got the news that I did indeed have sepsis, which is an infection that has spread to the blood, and that I likely picked up this infection through my port during my previous stay. But we were super lucky that the bug that I picked up was not a super scary one. It is one that they had a good antibiotic for. So they took me off of the other antibiotics and they put me on this one that was specifically targeted just for this bug. We also got the good news that I really didn't sustain very much organ damage due to the sepsis, because that is something that can happen. Sepsis is actually very, very dangerous, very, very quickly, and because it's in your bloodstream, it can really attack and shut down a lot of your organs. And so we really did make the right call, getting to the emergency room as quickly as possible and getting started on my treatment right away. I'm not quite sure how long I stayed in the hospital for that. Basically, I was just put on this specialized antibiotic, and every day they would come in and repeat all of the blood cultures. But unfortunately, because this infection started in my port, likely due to someone breaking sterile protocol when accessing me or accessing my line, the port had to be removed. I went in for surgery and they removed my little port, which was very sad because I had taken really good care of it for 1.5 years. It was working great and I didn't want to lose it. I needed it, and once they took it out, I no longer had reliable vascular access, considering the IV that they were giving me and the blood draws were not going well. But it had to come out. It was infected. There was no way that we were going to get all the infection out of it, and it was the only way that my body was going to heal. So out it came. After the port came out, it was kind of just a waiting game. We did my IV antibiotics. We repeated the blood cultures every day. They said that they would be able to put another port in once they were clear for long enough. I seemed to be fighting the infection pretty well, but unfortunately my body was having a hard time, so my blood counts weren't doing super great. I fought them for quite a while, but eventually became sick enough that they had no choice other than to do a blood transfusion. And for a blood transfusion, they can't just use like one of the peripheral IVs in your hands or your arms, especially the ones I had, which were really shoddy and didn't work very well. So they had to place what's called a midline, which is a line usually in your arm, but it can kind of go anywhere. It's a little bit longer than a regular IV, so there's a catheter that they put in. They use like an ultrasound to guide putting it in. It's not quite the same as a PICC line, but it's similar. A PICC line just goes a little bit further and goes right up to the top of the heart. Midline stops kind of halfway up. His blood is kind of like thick. It's hard to infuse. Anyway, So I had 2 units of blood transfused, which I was so nervous about because I was convinced that I was going to have a severe mast cell reaction. But everything was just going in the wrong direction and we really had no choice but to do it. So we did pre-medicate me with some steroids, and right as they were starting the blood, they gave me like an IV push of 50 milligrams of Benadryl, which I am a very lightweight when it comes to medication. So pushing 50 milligrams of Benadryl, I was like panicking. I felt so drugged and like so high and weird. I was texting my sister. I was like, what do you do when you get too high? And she was like walking me through what to do. She was like, just go with it. And I was like, I can't. I think I'm gonna stop breathing.
All right, well, we are going into the blood transfusion. It's gotten later and later.
Okay.
You all right?
I'm used to about 12.5 milligrams of Benadryl, and I just got 50.
This is quite a process.
Am I breathing? I'm breathing. Okay.
Scary. Just the Benadryl.
This is why I don't do drugs, people.
Well, anytime you've
Am I
taken
real?
50, it's been by pill. This was... Did you push it fast?
It's fine. I'm like, I'm fine, I'm fine. And then it's like, I just missed like time.
So did you want to give your thoughts about what?
So, we just pre-medicated for blood transfusion because...
Do you have to have your hand there?
Yeah.
Okay.
It reminds me that I'm alive.
Okay. I'm here. You're alive. Oh, those are funny.
These were sent to me by a viewer, actually. They were part of the hospital gift bag. The purple one. You can show them, it's over there.
This little hospital bag.
It's literally had everything I needed. Like I needed a hair tie, it was in there. Toothbrush, toothpaste, lotion, like just everything I've been using was already there for me.
So thoughtful.
But yeah, anyway, so I've never had a blood transfusion before.
It's just Benadryl. There's no blood started yet.
It's just blood. Never had one before. Really kind of nervous about it. I think most of it. Okay.
All right. I think in a minute or a couple minutes it's gonna.
Well, I have to give into it. You know how I fight everything.
Smooth out.
But I've never had a blood transfusion. Fought it tooth and nail every time they tried to bring it up. It's happening. So we're pre-medicating for that right now. And I'm sure I'll be fine. I've just been thinking about it too much today, I think. It's hard. I always say, like, with healthcare and all this stuff, it's always hurry up and wait. And that's definitely ringing true this time. It's just like, oh, I was supposed to be discharged today, but not with your blood levels. It's like literally half than like what we consider the low range of normal.
I'm gonna take a blankie.
So yeah, I'm wearing pants. It's just okay. Anyway, I'm nervous as heck, but everything's gonna be fine. It's the mental piece.
Well, it's very understandable that you always try to avoid these because
I try to avoid everything because I'm afraid of having a reaction to anything.
surreal. How are you doing in there? All I can see is a little face.
It's like when Sammy goes under the blankets and all you can see is like her nose.
All right, I'm gonna get you the ice chips.
Okay, so far. I'm just mentally.
Yeah, well, it's also
This is just mentally difficult for me.
crazy late. It's not what we had in mind.
So,
All right.
I'm just gonna keep breathing.
Well, you got your pregnancy pill. You got to do the pregnancy breathing.
Yeah.
There you go.
How do you do it?
I'll teach.
Oh.
Or I don't even remember, to be
Oh,
perfectly
great.
honest.
How did you even give birth?
Christina gets what she wants tonight. Some kind of crazy cartoon. What's it called?
Futurama.
Futurama. This is what calms her.
I feel like you would hate this show.
I'm not even going to watch it. I'm just going to be with you. All right. So this is what calms her down. Ice chips.
I ended up being fine. I also had a potassium infusion because my potassium got really low, which I kind of fought them on as well because, again, mast cell, but it got too low and my heart was starting to be affected, so we did that. I reacted to the IV versions, so we ended up doing like an oral version through the tube. Made me feel pretty sick, but it didn't give me the same whole body, like really awful, like itchy hives burning. It was more just like GI upset. Who knows with mast cell. I also had, this was a weird hospital stay. I had this really weird swelling in my left hip and I couldn't even really lie on my left side. It was so swollen, it was kind of bruised, and I had like this giant hard lump on the back and it killed. It like hurt more than my back and everything combined. We couldn't figure out what was going on. At first I thought it was because he harvested bone marrow from my hip, but he harvested bone marrow from my right hip. So there was no reason that my left hip should be this swollen and weird. I felt like I couldn't even put weight on my left side. So they actually tried to go in with like these big syringes and aspirate to pull fluid out because they figured it was like pockets of fluid, maybe there was infection. Nope, like they basically got nothing out of it. They cultured it, no infection, just swollen hip. I now know that my hip was actually just so out of place that it had like slipped up, and what we were feeling was like the top of my femur bone, and that's why it was swollen, because I literally was walking on a dislocated hip. EDS life. But that whole stay was just so weird. Just hallucinating the whole time, whatever. Finally, we got the word that my blood was clear and I could actually have them place a new port if I wanted to. And I've been pretty impressed with the surgeon who had removed my old port, and I figured, you know, starting over with another surgeon at home, especially right at the holidays, was going to take longer. I really liked this guy. The surgical team was good. Let's have them put the port in, but not access it, because after this whole infection thing, I kind of didn't trust anyone in the hospital to access it, to be perfectly honest. And so I was gonna have them put it in there, and then we would be discharged and I would go home. And this is probably why everything got messed up. I really wanted to keep my port on my left side. I'm used to using it on the left side. I'm right-handed. I ride passenger seat in the car, and I was just really wary about doing anything with my right side because a port, they do thread this little catheter into your jugular vein, and I have a stent in my jugular vein, and I've got this stent in my right jugular vein, and then I have my shunt going into my right atrium, and I wanted them to leave the right side alone and stick with the left. Things did not go as planned. I woke up from surgery. He said they had tried really hard to keep it on the left. Every time he put the needle in, instead of going up, it went down. So he wasn't able to get it on the left. So we had to close up there and open up the right and put it on the right. I knew I would probably end up with it on the right because they almost always have to switch sides. You end up with scar tissue and you can't use the same exact spot, so I wasn't surprised when I woke up. What I was surprised about was how much pain I was in on the left instead of the right. But I guess I just thought, well, you know, it's been opened up twice now and he did a lot of digging around, so that's probably why it hurts. And I gotta say, this port that's on the right is pretty darn awesome. He did a good job of placing it. It works great. It's actually probably better than the one I had on the left. Once again, we went home to our friend's house. Everything's great. And we plan to just stay in town for a couple more days. I was gonna have a swallow study and then we were gonna get out of there and home for the holidays.
The antibiotics are here. Oh boy, there is no amount of white balance to hide the circles under my eyes, and my oxygen masks it. But in the meantime, also a visiting nurse came and helped me get my home IVs set up for my IV antibiotics, which was nice. She also changed my dressing on my midline because I do still have a midline. We decided that we felt the most comfortable with them placing the port in the hospital, but then leaving it and having my nurse at home access the port for the first time. So we decided to keep the midline in to do the 5 more days of IV antibiotics that I have to do. So she got me all set up. So this is what my little home antibiotic looks like. It looks like this little jellyfish ball thing, and it attaches to the tubing, attaches to my arm. Super convenient. Literally all you have to do is hook it up and unclamp it. Don't have to mix anything, don't have to hang anything. It's wonderful. And because it's so small, you can like hold it in your hand and actually just put clothes on. Because that's probably one of the worst parts about being hooked up to an IV is like you can't change your clothes unless you want to like unhook everything and take it out through your sleeve or whatever. It's just the little things that you don't think about. So the next couple days, you know, I'm still in pain from my back. Now my chest is really hurting. My biggest issue was moving around because I really couldn't use any of the muscles in my back. I couldn't use any of the muscles in my arm or chest. And then I still have a lot of pain and weakness in my abdominal muscles from all of the shunt surgeries. So I was just struggling with moving. Like I could not turn over in bed, and if I like started to slide down on my pillow, I couldn't like sit up. It was really hard. And so I was really lucky. We had this friend Teresa. We ordered like a bed rail like I have here in my room. I'll insert some kind of footage, and that really helped me to get out of bed. So I really recommend that as a recovery tool or as an everyday tool. I keep mine there all the time. And I was also having a really hard time breathing, and you know, we kept chalking it up like, is it just because the muscles are so tight across your chest after having all of this surgery, and then, you know, maybe this house was dusty, or I was being exposed to some kind of trigger that I didn't know about. And then we found like a spot with mold, and we're like, oh, it's her mold allergies and that's what's going on. So I'm doing like lots of nebulizers. I'm probably the only one in the entire world who ever actually took home their little incentive spirometer and was actually doing it like 3 times an hour or whatever you're supposed to do, which, by the way, made me worse. So thanks a lot, spirometer. I'm feeling a little bit better, but something that I'm really struggling with is my breathing. And I don't really know if it's lung related. I feel like it's more tightness related from all of the surgeries. Just my ribs are already really tight after the back surgery, and then having to have like my chest cut open twice on that side and once on this side. I feel like my body just doesn't want to breathe, but I'm trying everything I can. I've been doing extra nebulizers, extra treatments, and working with my little incentive spirometer here, hoping it gets better. It feels it doesn't feel like junky, and I'm not coughing, so nothing's really coming up. It just feels really tight. So I'm just hoping it's nothing like pneumonia setting in or something like that. I don't know. I can't deal with any more things right now. I was really struggling with it last night. I kind of broke down a little bit because I was just so tired, and I couldn't fall asleep because every time I fell asleep, like, I would stop breathing. Yeah, rough night. But today is a new day. I am setting up my home IV antibiotics all by myself for the first time. It's super easy. Then I have more nebulizers to do. And I'm hoping that with all that, I can somehow manage to get enough energy to wash my hair. It's like 90% dry shampoo at this point, and I just feel so gross. I can't take a full shower because I still have dressings and a wound down my back and on my chest, but we have that like weird hair funnel thing. I don't know if you guys remember that. Okay guys, it is happening. We are gonna wash my hair. I don't think my hair has been washed since I had my spinal fusion, however many weeks ago that was. And it's pretty much just dry shampoo and hair product at this point. It's disgusting. So if you guys remember from my past vlog a long time ago, we have our trusty hair funnel here, which is a crazy thing that you strap around your head and you can wash your hair without getting your body wet. Since my back and my chest is still not quite ready to be submerged. If you see me in public, my hair is gonna look fantastic. Just don't get too close. Stop making me laugh. I can't breathe and talk and laugh at the same time. Hello you guys. Oh jeez. Balloons everywhere. Hi, it's Tuesday and we are off to the hospital because that's apparently the only place we ever go. But I am excited. I am having a swallow study done to see if any of my swallowing has improved with any of my recent surgeries. I'm not quite sure what the results are going to show, but I'm excited to be at least trying it. We're going to be modifying the test quite a bit. I already took my first round of pre-meds last night. Huge shout out to Beth, my swallow therapist. She was actually my therapist 3 years ago when we placed my feeding tube, and she's very, very knowledgeable about EDS and about mast cell and about swallowing issues. She completely like redesigned the typical barium swallow so that I could do it as safely and effectively as possible, which is fantastic because honestly in Boston I can't even get a call back from a swallow therapist. So what we decided on, we pre-medicated me the night before with steroids, and then I took steroids again in the morning. Then, right as we were beginning the test, she had me inject just some dissolved Benadryl into my G-tube so that the Benadryl wouldn't kick in really during the test, but it would already be starting to work in my system when the test was over. Because, of course, I'm allergic to the dyes that they use, or at least I'm allergic to barium. And because of this, we actually opted to use a different dye. And this dye is called gastrographin, which is a dye that she had only ever used one other time before. I asked them if it had a lower mast cell reaction rate, and they said not really. It's kind of the same. But because I had the documented barium allergy, they figured they might as well take a chance on the one that I didn't have a documented allergy to. We're gonna be mixing it in with like cream of rice because I think that rice is probably the safest food. My mom was so amazing. She was running all around the world, and Teresa looking for like a cream of rice or like a rice cereal that didn't have a bunch of added ingredients. We found one on Amazon, but it wouldn't get here in time. So we just found the least threatening looking one. I think it's fortified with iron and B12. And we'll just see how it goes. I'm like, guys, we're like really nitpicking here since I'm going to be swallowing radioactive dye with it. Like, I'm probably going to react. Not to mention that I haven't had food in 3 years. So my stomach is going to probably react to having food. Whether or not it's a mast cell reaction, it's just kind of normal since I haven't had to digest it in a very long time. Not really looking forward to that, as I'm already feeling pretty sick from the antibiotics and I still am not breathing great. I think most of it still is that rib tightness, but it does seem like there's something that maybe I'm allergic to in this room. We're trying to like move me around the room.
Just reminded me, maybe I
see
better
if
pack this.
Yeah, no, definitely. We travel with blue bags. A lot of blue bags. If you haven't seen a blue bag before, good for you. But they're called emesis bags.
Honestly, you haven't used them.
I don't, but it's a comfort. I always carry them around in my bag. Never know what's gonna happen. Never know who you're with. But anyway, yeah, we're hoping maybe my breathing problem is due to an allergy and not something more serious. I keep thinking that it feels like when I had pneumonia before, but I'm not really bringing anything up. I don't have a fever, and I had 2 chest x-rays when I'm in the hospital. Last night it got really bad, but then we were like, well, she's having a swallow study tomorrow, so she's gonna have 2 people looking directly at her chest through fluoroscopy. That'll probably get us some answers faster than we could get through going to the ER.
Final prednisone pre-dose done.
You better be speeding.
Yeah, so
you guys, I am beat. My mom and I decided to come home and take naps. So of course she's over there napping and I'm just laying here. I took 50 milligrams of Benadryl and I still can't fall asleep. I think that it probably has something to do with the stress doses of prednisone that I had to take last night and this morning so that I didn't have an allergic reaction to the swallow study dye. So I'm just resting and running my little antibiotics, and I'm gonna run some IV fluids, which will hopefully help me to flush out said dye. It was a little bit finicky. I didn't realize this. It has to be bonded to something that's cold.
and we had decided to use cream of rice as our carrier, which is something that is usually warm and you have to warm it up to mix it.
And so normally they have like very specific thicknesses that they give you. It's like pure kind of water liquid, and then there's nectar and honey and then something else and then pudding. So she had to try to use like the cream of rice that we brought with rice milk and like rice flour to try to get those consistencies and then get them cold and then mix the gastrografin in.
The ratio has to be just right for it to be visible on the scanner.
So she had a lot of work to do. She was over there doing some like magic chemistry. And then my radiologist came in and we got me all set up in the chair. I gave myself my little injection into my G-tube of my Benadryl. And we did the test, which is basically you just sit there and you swallow the stuff and they watch it and then you're done. I am not gonna lie, gastrografin does not taste very good, but that doesn't mask the fact that I got to take my first bite of food in 3 years, which is really exciting. Not really the food I was looking for, but it is a start. And my test was actually so much improved from my last test that I have been cleared to actually try out different loose purees. So we had like one thickness that was probably like applesauce texture, and they said that that was my ideal texture. I still have swallowing issues, but I was able to get that one down without getting any in my lungs or under my epiglottis or up my nose or anything funny like that. So yeah, I get to eat again if my mast cell allows me to. And I swear, since I got the tube, everyone's been asking me, what's the first food you want to have? And honestly, I usually answer carrots. So I told her that I wanted to have carrots, and she said that was actually a really, really good choice for me. If I boil them and then puree them, they are pretty low on the mast cell list, and they're nice and easy to swallow. So it looks like sometime very soon I might get to have carrots. I can't believe it. It's been 3 years. 3 years of tasting only toothpaste and sitting at meals and smelling everything and wishing I could try it too, and thinking about what Indian food might taste like or Ethiopian food. And now I feel like I'm finally getting to take steps towards that, which is amazing. And I'm totally cleared to go home. So as soon as we're able to get all of this stuff in the car, it's going to be a little bit difficult with my mom's broken arm. We're going to have to call in some reinforcements. Teresa said she and her husband would come and they would help us out. And of course Jean, but we don't want to make her lift too much. So yeah, I get to go home and spend the holiday with my family. I can't believe it. I'm so excited. And I'm kind of thinking of like bringing some of the cream of rice to Christmas dinner and surprising my family, especially my grandparents, by taking a bite. Hello you guys. Happy Tuesday morning. How's your morning going so far? Let me tell you how mine is going. This morning I woke up to frantic text messages from a number that I did not recognize, telling me that it was an emergency and I needed to call them back. So eventually I pulled myself out of sleep and I texted them and I was like, hey, who's this? And it was my radiologist. I'm like, shoot. So I walk over to my mom's room. By that time, I realized something's really wrong. I can't breathe. I can't talk. I woke her up, showed her the messages. She called him. Oh, poor guy. I thought we were like already on the road driving home to Boston and that we were gonna end up at some random hospital in the middle of nowhere. And so the x-ray that they took the day before for my swallow study to line up the machine ended up in his caseload and just came across his screen that morning, and he saw that I had a pneumothorax. And a pneumothorax is when there is a hole in the lung for whatever reason. It can be because of a tear, or it could, for example, be because somebody accidentally stabbed it with a needle while trying to place a port, and then the air leaks out of the lung and into the sac that kind of surrounds your lung. And this is not a good thing, because the more air that leaks out, the less the lung can expand, and it's really painful and it makes it really hard to breathe, and eventually it can collapse your lung, and if it goes untreated for too long, it can actually start to push on your heart. We literally just immediately rolled out of bed, drove to the hospital, and had x-rays done. Before I even stepped out of the x-ray office, I get a call to go upstairs and see the port surgeon. He took one look at it and sent me to the ER. He was hoping that if
he put me on 100% oxygen with a non-rebreather mask overnight, that hopefully everything would heal up on its own and I could walk out of there the next day, which sounded super great, even though I had kind of low hopes for the whole spontaneous healing thing, knowing the nature of EDS. Okay, so the deal is that we got the chest x-rays. As we were walking out of the x-ray office, my doctor starts calling me and says, just go upstairs to the surgeon's office. He said when they were trying to place the port on the left and failed, they must have nicked my lung somehow and created a slow leak. He said it was pretty stable from where it was yesterday, so he thinks that the leak itself has repaired, but that the air is still trapped. So the plan now is for me to be admitted to the hospital overnight, put on a special oxygen mask with 100% oxygen, try to help my body absorb what's stuck in there, and hopefully my lung will re-inflate. I guess we're not going home tomorrow, maybe the next day. I will be home for Christmas, mark those words. So we went to the ER, we started the oxygen thing. My original scans, I believe, showed about a 25% collapse of my left lung. I think by the time we got there and had x-rays redone and stuff like that, I was at about a 60% collapse with some pressure on my heart, which earned me a bed in the ICU. And by the next morning, my lung was over 80% collapsed and my heart was like pretty much on the other side of my chest. I wasn't able to talk. I was gasping for breath. It hurt so bad, even on their super aggressive oxygen thing. So that was when they were forced to place a chest tube to try to help suction out some of that air and hopefully re-inflate my lung. Having a chest tube placed actually feels a whole lot like you would expect it to feel, but it was actually a nice and quick process. Unfortunately, it was so quick that it seemed to kind of all happen before the local anesthetic and sedation actually took hold. So that was great. And they actually placed it like right through my breast tissue, so I called it my boob tube. And let me tell you, if you think that air in the sac around your lung hurts, try having air and then a giant coiled up tube in there. I was not a happy camper. And if you know anything about pain meds, you know that they suppress breathing, so there wasn't a whole lot of that going on. It was mostly Tylenol and just kind of waiting it out. But I have to say, as soon as that chest tube was put in there and I was put on suction, I started to feel better pretty fast. Breathing got a little bit easier. Still painful, obviously, but I was able to talk and communicate, and they said my lung inflated pretty quickly. It was just that we were having a hard time getting that last bit of air out. They expected it to take like a day, and I think it took like 5 days. At one point they turned the suction off, thinking that just gravity would pull the air out, and that didn't work. We had to turn the suction back on. So it was getting kind of hairy. All I wanted was to get home for Christmas. That's it. That was my goal. I really wanted to be home for Christmas. I'd been in the hospital for Christmas before. I'm always sick on Christmas. I just wanted to wake up with my family that morning and open stockings and do the whole Christmas tradition stuff. I had missed out on Thanksgiving and all of the Christmas season. I just wanted that Christmas morning. So I was starting to get a little bit antsy. But I think that having a goal like that really helped me to keep things in perspective and have something to look forward to and just try to get better for. And we had such sweet friends down there. Jean and Teresa and Amanda and all of my nurses who are really just so positive and making an effort to bring little bits of Christmas to me and to reassure me like, hey, we're gonna get you better, like it's gonna be okay, we're gonna do this, it's all gonna be great, we'll get you home for Christmas and get you home to your sister and your dad. So as hard as it was being away for the holiday season, I think it was definitely a really good motivator. Not that I wasn't already trying to breathe, but I was really trying to breathe then. So over those 5 days, slowly my lung reinflated, the air was coming out. The deal was if I had 2 clear x-rays in a row, I could get the chest tube out, and then if I had 2 clear x-rays in a row after that, then I could leave. So I think it was maybe like the 20th or the 21st that we were finally able to get that chest tube out of there. And then I had to have 2 x-rays 24 hours apart that showed that everything was holding. So the stars magically aligned. The morning of the 23rd, I had my second clear x-ray. Actually very good timing, because like a half hour after that, they had finally finished with the custom brace that you are now seeing here. So they came and brought that. Obviously it has this nice little hole here for my new port, and it has a nice little hole down here for my feeding tube. It was kind of a one-shot deal with this brace. Usually these are like a 4-fitting brace, and I didn't even really have 1 fitting. They just took measurements and we just hoped it would be okay. Okay guys, so this is my life for the next, I don't know how long, but I am being discharged. It is December 23rd. We are getting in the car, we're going home, and I am going to be home for Christmas. And I am so excited. I can't believe it. My chest x-ray came back good this morning. No more pneumothorax. We're patching up. We got the dream team. We're getting out.
The dream team, our 2 angels. This is her cervical, thoracic, lumbar sacral brace. She had been wearing,
the G-tube.
yeah, custom.
Cut out for the
So she said not only can she get to her G-tube, but she can expand her stomach better, and a place that she can access her port. And so it was amazing. We prayed, please God, let it be right this first time. He came and took measurements 2 days ago, and because we didn't know what we were going to do, we're ready to leave, and if it just didn't fit, then what? Lauren and Dad, here we come.
And see you soon.
And Jean and Teresa, we can't thank you enough. We'll miss you, we love you, but we'll be back.
I love this child, I love this family. Thank you guys for everything. Wonderful 6 weeks. God bless you. Love you.
So, thank God this brace worked. It did actually come up way too high in the armpits when I got it, but I was willing to put up with that if it could get me home. My dad did kind of like sand and Dremel off about like 1 inch under my arms though when I got home. It's really great. It's good having a handy dad. He actually took footage of that you guys will see in next week's vlog, but it's definitely made it a whole lot more comfortable, and I've been able to tolerate wearing it a bit more. But I had my x-ray, I got my brace, they pretty much cleared me to leave, and so my mom, our host Jean, our friend Teresa, and some other friends all just like frantically packed the car. I did all of the discharge stuff within the hospital. They showed up with the car, loaded me in there. We did not pass go. We did not collect 200. We just got the heck out of there, drove straight through the day, straight through the night, and made it home Christmas Eve morning. Should I maybe have stayed down there and rested another day or so? Maybe. Was it a rough drive? Heck yes. Would I do it all again? Heck yes. After all of that, we were just so thankful as a family. It was just like all of the things that we were worried about, meals and presents and everything, it didn't matter because we were together, and that was the best that we could have hoped for. It was kind of like when the Grinch stole Christmas and just no one cared. We were just so grateful and happy to be together as a family on Christmas morning. Don't worry, I do actually have some vlog footage from Christmas and beyond there, but I kind of felt like I couldn't just put up a Christmas vlog without explaining why I was gone for like a month. So yeah, that's basically what happened and where I've been. It's a little bit humbling to just lay it out like this in a timeline. It's been a really crazy month, and I'm still really just settling in since we got home right at the holidays, and then my birthday is the day after Christmas. It's been kind of hectic, but I really want to thank everyone who has sent cards and packages and stuff from my Amazon wish list. It was overwhelming to come home to so much love and kindness, and I wish I could thank every single one of you by name, and I wish that I could unbox every single package on film. The truth is, we were pretty much opening our Christmas gifts out of sealed Amazon Prime boxes on Christmas. We were not prepared, so all of the gifts were kind of mixed together, and it was almost a swap of like, oh, I think this one's for you, and I think this one's for you. So I'm sorry if I haven't properly thanked you. I'm still sorting through cards. You have no idea. It means the world to me. You guys will definitely see the things that you've sent in vlogs in the backgrounds, I'm sure. So please don't think me ungrateful or get worried that something's gotten lost just because I haven't thanked you yet. I've been exhausted since getting home, and I really have not been able to do much at all. Please do not think that I do not care, because you have no idea how much it means to me. I just love you guys so much. And also, thank you for people who sent cards and gifts to my family as well. I think that sometimes people forget that when a family member is sick, the whole family is affected, and that was just really touching for me, but also for them. So thank you. As for how I'm feeling now, you guys will see a whole lot more in my upcoming vlogs about my recovery process. I think that it's going to be a lot longer of a recovery than I expected because of all these complications. I also think that it'll be a lot more difficult of a mental health recovery. I'm trying to be as open and as proactive about my mental health as I am my physical health. I've been looking for the right therapist, but the truth is, I don't really have a lot of time in my schedule and energy, so we haven't really gotten started on that yet. I'm kind of wary to make an appointment, not even knowing what's going on and when I'll be around. But we're coping. Like I said, I'm being honest, so my family's checking in with me, and things are gonna be okay. We're getting there. If you want to see more videos by me and follow along in my recovery process, you can hit that subscribe button and the bell. And some of you may have noticed on my social media that my extended family set up a GoFundMe page for our family. A couple years ago, my mom actually had to stop working to pretty much become a full-time caregiver for me. As you guys see in my videos, she drives me absolutely everywhere. Twice a week she has to drive me like 2 hours of physical therapy and 2 hours back. We do a ton of medical travel. A lot of our doctors are out of network. Now my sister is going to be having surgery and will have to stay out of state for that. Medical bills are just, they're piling up. Our house needs adaptations to properly accommodate some of our needs. There are a few specialists that we think that could really be helpful for me in my recovery that are just out of our reach financially right now, and it's really just over our heads at this point. We 100% understand that most of you guys watching this are probably in the exact same boat that we are, and we definitely are not expecting any donations from you guys. Please hold on to your money for your own medical needs. I will not be offended. I'm just putting it out there. It's placed on your heart and you feel like you're in a position where you were able to give. I will have that linked down below. But besides that, I guess that's it, and I'm excited to see you guys next week. Bye.